Weight loss, in the context of medicine, health, or physical fitness, refers to a reduction of the total body mass, due to a mean loss of fluid, body fat or adipose tissue or lean mass, namely bone mineral deposits, muscle, tendon, and other connective tissue. Weight loss can either occur unintentionally due to malnourishment or an underlying disease, or arise from a conscious effort to improve an actual or perceived overweight or obese state. Unexplained weight loss that is not caused by reduction in calorific intake or exercise is called cachexia and may be a symptom of a serious medical condition. Intentional weight loss is commonly referred to as slimming. Do you have trouble losing weight? Counting calories, exercising for hours every day and trying to ignore your hunger? Eventually people often give up. An excessive focus on counting calories has certainly not done much to reverse our current obesity epidemic. Fortunately, there may be a better way. Here are more tips to lose weight. Add protein to your diet, avoid processed foods, stock up on healthy foods and snacks, limit your intake of added sugar, drink 6 to 8 glasses of water every day, drink unsweetened coffee, avoid liquid calories. Limit your intake of refined carbs, fast intermittently and drink unsweetened green tea, eat more fruits and vegetables, count calories once in a while, use smaller plates, try a low-carb diet, eat more slowly, replace some fat with coconut oil. Add eggs to your diet, spice up your meals, take probiotics or live bacteria that have health benefits when eaten, get enough sleep, eat more fiber, brush your teeth after meals. This is because many people do not feel like eating after brushing their teeth. Combat your food addiction, do some sort of cardio, add resistance exercises, use whey protein, practice mindful eating and focus on changing your lifestyle. Techniques. The least intrusive weight loss methods, and those most often recommended, are adjustments to eating patterns and increased physical activity, generally in the form of exercise. The World Health Organization recommended that people combine a reduction of processed foods high in saturated fats, sugar and salt and caloric content of the diet with an increase in physical activity. Self-monitoring of diet, exercise, and weight are beneficial strategies for weight loss, particularly early in weight loss programs. Research indicates that those who log their foods about 3 times per day and about 20 times per month are more likely to achieve clinically significant weight loss. An increase in fiber intake is also recommended for regulating bowel movements. Other methods of weight loss include use of drugs and supplements that decrease appetite, block fat absorption, or reduce stomach volume. Bariatric surgery may be indicated in cases of severe obesity. 2 common bariatric surgical procedures are gastric bypass and gastric banding. Both can be effective at limiting the intake of food energy by reducing the size of the stomach, but as with any surgical procedure, both come with their own risks that should be considered in consultation with a physician. Dietary supplements, though widely used, are not considered a healthy option for weight loss. Many are available, but very few are effective in the long term. Long-term weight loss. In order for weight loss to be permanent, changes in diet and lifestyle must be permanent as well. There is evidence that counseling or exercise alone do not result in weight loss, whereas dieting alone results in meaningful long-term weight loss, and a combination of dieting and exercise provides the best results. Meal replacements, orlistat and very low-calorie diet interventions also produce meaningful weight loss. Unintentional weight loss may result from loss of body fats, loss of body fluids, muscle atrophy, or a combination of these. It is generally regarded as a medical problem when at least 10% of a person's body weight has been lost in 6 months or 5% in the last month. Another criterion used for assessing weight that is too low is the body mass index (BMI). However, even lesser amounts of weight loss can be a cause for serious concern in a frail elderly person. Unintentional weight loss can occur because of an inadequately nutritious diet relative to a person's energy needs, generally called malnutrition. Disease processes, changes in metabolism, hormonal changes, medications or other treatments, disease or treatment-related dietary changes, or reduced appetite associated with a disease or treatment can also cause unintentional weight loss. Poor nutrient utilization can lead to weight loss, and can be caused by fistulae in the gastrointestinal tract, diarrhea, drug-nutrient interaction, enzyme depletion and muscle atrophy. Continuing weight loss may deteriorate into wasting, a vaguely defined condition called cachexia. Cachexia differs from starvation in part because it involves a systemic inflammatory response. It is associated with poorer outcomes. In the advanced stages of progressive disease, metabolism can change so that they lose weight even when they are getting what is normally regarded as adequate nutrition and the body cannot compensate. This leads to a condition called anorexia-cachexia syndrome (ACS), and additional nutrition or supplementation is unlikely to help. Symptoms of weight loss from ACS include severe weight loss from muscle rather than body fat, loss of appetite and feeling full after eating small amounts, nausea, anemia, weakness and fatigue. Serious weight loss may reduce quality of life, impair treatment effectiveness or recovery, worsen disease processes and be a risk factor for high mortality rates. Malnutrition can affect every function of the human body, from the cells to the most complex body functions, including immune response, wound healing, muscle strength including respiratory muscles, renal capacity and depletion leading to water and electrolyte disturbances, thermoregulation and menstruation. In addition, malnutrition can lead to vitamin and other deficiencies and to inactivity, which in turn may predispose to other problems, such as pressure sores. Social conditions. Social conditions such as poverty, social isolation and inability to get or prepare preferred foods can cause unintentional weight loss, and this may be particularly common in older people. Nutrient intake can also be affected by culture, family and belief systems. Ill-fitting dentures and other dental or oral health problems can also affect adequacy of nutrition. Loss of hope, status or social contact and spiritual distress can cause depression, which may be associated with reduced nutrition, as can fatigue. If you like this video, give it a thumbs up and share it with your friends. If you want more insights and tips, don't forget to subscribe and click the notification bell for updates.